morning, everyone. I'm Hartford Healthcare's Tina Verona. Thank you once again for joining us. As we mentioned yesterday, we kicked off our daily media briefings that we are going to have every day at 11 a.m. just for the time being until further notice, where we are assembling a group of our clinical experts from all different areas across Hartford Healthcare for you to have a chance to ask your questions. This will be the only opportunity, so we encourage you to write your questions in the chat, and we will get to them in the order that they are received. Lots to talk about again today, as is every day. We have with us Dr. Ajay Kumar, our Chief Clinical Officer from Hartford Healthcare, and we also have with us Dr. Ken Robinson, who's the chair of the emergency department at Hartford Hospital, to talk a little bit about what we are seeing in the emergency department and what folks need to know. So to kick things off, as always, we'll go to Dr. Kumar to update us on Hartford Healthcare's status.
Thank you, Tina, and good morning, everybody. Yesterday, we covered a fair amount of topics after meeting in a few days, and today, I'll try to go over some of the highlights here. So today, Hartford Healthcare is seeing about, we have about 419 patients in the hospital across the system. Now, just as a reminder, in the peak of pandemic, back in 2020, I believe April 20th, we had 425 patients admitted at the time. So we're very close to peak, and I would not be surprised in a day or two, we will see that number exceeding in Hartford Healthcare. What's really important to note at that particular moment, we had about 128 patients who are ICU bound. They were in critical care. And right now, with the 419 patients, we have 55 patients in critical care. So we are seeing this disease, which is requiring a hospital stay, but not in critical care. We still believe it's predominant is Delta. We are seeing that largely in unvaccinated individuals, but there are some vaccinated individuals are also being admitted at the moment. We have seen a fair amount of individuals who coming to the hospital happens to be positive with COVID, but they're admitted for some different reason as well. This is happening across system. So it's an interesting time we are in right now, where the data on surface needs to be questioned to understand the real issues which we're dealing with right now. Nevertheless, still we're in the middle of pandemic, and we have to be cautious about all the precautions Dr. Wu and Keith Grant and other members of my team have talked about repeatedly. But to give you a glimpse of the entire system, we have today 40 patients in Bacchus Hospital. Charlotte Hungerford has 31 patients. Hartford Hospital has 157 patients, which is one of the highest we've seen in Hartford Hospital. Midstate Medical Center has 44 patients. Natchag Hospital has 3 patients. St. Vincent Medical Center has 57 patients. Hospital Center Connecticut has 66 patients, and Wyndham Hospital has 21 patients. One of the most important impact we've seen in this particular surge right now is the impact on our emergency rooms. We are seeing a large number of individuals visiting our emergency room for a variety of reasons. And I'm fortunate to have my colleague, Dr. Ken Robinson, who will talk a little bit about his experience from emergency room perspective. Thank you.
Good morning, everyone. Thanks, Ajay. The most important thing that I'd like to convey is that I don't want people to be worried about coming to the hospital and thereby delay coming to the hospital if they have a serious worry. Chest pain, shortness of breath, if they think they might be having a stroke. We have been doing this for almost 2 years now regarding the COVID protocols. We know how to do it. We do it every day. We know how to keep people safe and keep potential patients with potential COVID separate. Bottom line, it's safe. Do not delay coming to the hospital if you think that you are having a serious complaint or you're worried. That being said, we are seeing an increased volume. A lot of people are worried that they have COVID. They're also looking for testing. And besides that, we're seeing a lot more people, as Dr. Kumar described, with high acuity complaints that are needing the ICU. Some of them are not COVID related. So our volume is up. We are managing it at this time. And I'll stop there and let you ask any questions or.
Thanks, Dr. Robinson. We do have Dr. Wu, who is joining us as well. We'll have him give some opening remarks, and then we do have some questions coming into the chat that we will begin to address. Dr. Wu?
Thank you. I think Dr. Kumar and Dr. Robinson summarized it very nicely. Just what we're doing on a daily basis is we're looking at the numbers. And for those of you who have heard me talk before, we're not just looking at the positivity rate, but we're looking at the positivity rate in relation to hospitalizations as well as in relationship to ICU and ventilators, because that will really give us a direction of what we are going in and the relation of Delta to Omicron as well as influenza. So I'll stop there. Thank you.
All right. Thanks, Dr. Wu. We do have a lot of questions coming in. The first one is from Pat Eaton Robb from the Associated Press. Can you address capacity, and are there any plans being made to add capacity amid the surge? Also, do you know how many patients came in for COVID and how many were diagnosed after coming into the hospital for something else?
I'll take that one. Pat, thanks for asking this question. So, Hartford Healthcare has a fair amount of capacity across the system. In every winter, we see a significant surge for a variety of reasons. This time it happens to be predominantly overtaken by the COVID. Normally we would see flu or other respiratory illnesses. So we do find ourselves in the wintertime with a bit more stretched with capacity. However, the way we think about the capacity is the capacity in critical care. And as I articulated earlier on, the COVID is not stressing our critical care capacity right now. It's about other illnesses and disease at the moment. Inpatient side, our capacity is challenged at the moment, given the COVID patient does require longer stay in the hospital. But with the way we manage the throughput and expected number of discharges, the number of capacity we have, an extra space we can create in with rather ease is also we are able to manage at the moment. The significant challenge we're finding is in emergency rooms right now. Across the system, we have seen a tremendous number of patients coming to the emergency room, generally for mild disease or sometimes for testing only. And that does actually increase our impact on ED or emergency rooms. However, we do have different ways to manage capacity by converting some of the space, which we have normally not staffed, but we can staff during the surge time. And it always depends on the wonderful colleagues we have across the Hartford Healthcare system. The people are giving up a lot of their time and their effort, and they're coming on staying for extra shift or doing extra shifts as well to make to meet the demand at the moment. But we're not constrained in terms of capacity at the moment. But we are at the point right now where our staff is stepping up on every single day, every single moment. One little extra moment or hard work they're doing at this time to manage the need at the moment. The next question you asked is about how many of diagnosed coming in hospital for something else. Pat's a great question. We're doing a data analysis as we speak, and we'll hopefully talk a little bit more about that in future meetings. We have seen a fair amount of individuals, and I wouldn't be able to put the numbers right now at this time, but a fair amount of individuals who are coming in for unrelated reasons, and they happen to be COVID positive. We also continue to see phenomena where the patients come in with what appears to be COVID-like symptoms, and they may have been tested negative, but they convert positive because sometimes late conversion occurs and patients become positive later on. That's why data becomes really difficult to analyze, but we will present some information in next few days on that part.
Our next question comes from Mary Catherine from Hearst, Connecticut Media. Has testing capacity for the public across the health system changed at all over recent weeks or months, or has it stayed roughly the same? And are you able to say how many people you test per day roughly?
Yeah, our testing capacity is going up every day. We are seeing a tremendous demand on testing across the system. We still have some more work going on to increase the capacity. Dr. Carter mentioned yesterday about several trailers will come online in Hartford Healthcare and more access will open up. We have seen a tremendous increase in capacity in testing requirement. I'll give you a small data point. Back in early December, we had a testing requirement about 250 to 230 individuals who were testing a day. Right now, it's about 1,500 to 2,000, somewhere around that. So that's a significant increase in the testing demand at this time. We expect this demand to continue for some more time. We do need to create more access, which we're working on right now.
Question from Alex Putterman at the Hartford Courant. A question a lot of readers have asked: if Omicron is believed to cause less severe illness than Delta, why has it caused such a spike in hospitalizations? Dr. Wu, do you want to start with that one?
Yeah, absolutely. I think what has happened is that there was an overestimation of what the Omicron percentage was in the country, especially with Connecticut. A lot of our hospitalizations are still due to Delta. We have looked at sequence samples from the week ending the calendar year, and it was by 10 to 1 still Delta as compared to Omicron. And so that's why we are still seeing these patients. But let's just say that there is an increase in Omicron and that there is not much Delta, which I don't believe. Just by the sheer numbers of Omicron, with the increase in cases, you're going to have an increase in hospitalizations as well. And I think Dr. Kumar correctly pointed it out on yesterday's media briefing that even though our numbers, our hospitalized numbers are higher, our ICU and ventilated numbers are much lower as compared to last year. And so I think we're seeing right now a split between Omicron and Delta at this point.
The second part to Alex's question: what share of COVID patients have significant COVID symptoms as opposed to having tested positive after being hospitalized for another reason?
And you want to take this on because you're seeing on the front line, then Ulysses can follow up on that.
Sure. We're seeing a really high percentage of patients with mild symptoms. If COVID wasn't around, this would feel like a flu year. The runny nose, low-grade fever, maybe a mild cough. The large portion of the patients that we see who have COVID are well enough to go home. So I think that answers that question.
Ulysses, are you still there? Yeah.
Sorry, multitasking. I apologize. I would agree. What I'm seeing, and just anecdotally, getting reports from the community, is that a lot of patients are not coming into the hospital. But I think Dr. Robinson's assessment of it is absolutely correct. If we took away the COVID, this would be very similar to what we've seen in previous years, what we call the influenza-like illness, the ILIs, and that's how we would categorize it. So.
Thank you. Patty and Rob from the AP, have there been staff shortages associated with this more contagious strain? How are you dealing with that? Dr. Kumar, do you want to take that?
Yeah, Pat, it's again a great question. We are seeing some shortages in some areas across the Hartford Healthcare. However, as I mentioned, the culture of this institution is quite impressive, and I'm so grateful to colleagues who work in Hartford Healthcare. Every single individuals, whether they're in transport right now, the nurse or the physicians, or they're supplying food to the patients, everybody's giving a little bit extra at the moment and making sure that we are meeting the need for the community. And for that reason, we've been fortunate enough to not reduce any services across the system. We continue to operate with full capacity for access for the patients to care for them. We do keep a very close eye on our staff to make sure that they're supported. We are making sure that they are rested, and when they come back, they're ready to take care of the patients as well. So there's a fair amount of work going on. One of the really important things to note that the Hartford Healthcare is adding more than 300 individuals. Actually, Monday they were oriented. So we continue to recruit individuals as well in Hartford Healthcare as a cohort. We think we are going to continue to see this challenge for several weeks, but also I think we are going to continue to meet the challenge as it comes and meet the demand for the society as well. So it's an area which we pay continuous attention to. If the numbers change tomorrow or the things differ, we will act accordingly. But right now, we feel comfortable in managing where we are.
Our next question comes from Jordan Fenster at First Connecticut Media. Regarding vaccinated COVID patients, can we get specific about what we are seeing, the age breakdowns, comorbidities? If, as Keith said yesterday, they are largely immunocompromised, can we get specifics on that?
Yeah.
Dr.
Let's carry on. Sorry.
Yeah, no, sorry. So I don't think we can get into necessarily the specifics. All we can tell you is that the people who are not doing well, who are vaccinated, tend to have comorbidities, age being one of them, obesity, severe obesity, morbid obesity as well, but as well as other medical conditions, whether it be the heart-related, whether it be immunocompromised from malignancies, chemotherapy, steroid utilization. So unfortunately, I don't have the specifics for you. I can tell you that our number has crept up, not necessarily for HHC, but for the state, where before we were probably about 22% were vaccinated that were in the hospital. That's probably up to about 29, 30% at this point. But when you drill down to the ICU ventilated numbers, that number is still low, in the low 20s in terms of those who are vaccinated.
Next question comes from Mike Savino at Channel 3. We're seeing more children end up in the hospital with COVID. Is there something specific about Omicron and how serious are these cases? Dr. Wu or Ajay?
I find myself not equipped enough to answer the questions for children, and I would rather have this question directed to our children's hospital or specialists who are experienced in that management.
Our next question comes from Leslie Mays at NBC Connecticut. How should families manage isolation quarantine requirements? Example, a family has a child at home due to exposure at school. The child has no symptoms. Can parents continue to go to work? The adult has exposure but no symptoms, test negative. Can their child continue to go to school when someone has an exposure but no symptoms? How should they manage interacting with others at home? Dr. Wu?
Let me make a comment before Dr. Wu makes a comment. This is a question which may require a consultation and further discussion here. However, general rule is that if somebody is symptomatic, somebody has illness, they need to be isolating at the moment. Follow your school's guidelines. That's the most important thing. Every school has a very well provided guidelines, and I advise everybody to follow. And if you have further questions, do communicate with the pediatrician's office and seek their advice as well. Ulysses, you have anything else to add to that?
No, I think that's the perfect way to answer that. Absolutely.
Very specific question there. Our next one comes from Tracy O'Shaughnessy at the Waterbury Republican American. Dr. Wu, you've said that the vaccine is intended to reduce severe disease, hospitalization, and death. Why then are a higher percentage of vaccinated patients testing positive to COVID? And do you consider, quote, fully vaccinated to be 2 shots or 3?
Tracy, I don't know where that data is that it's a higher percentage of vaccinated patients testing positive for COVID. As far as I know, nationwide, the majority are still unvaccinated that are testing positive. We do have vaccinated that are testing positive, but again, it's prevention of acquisition of disease is an added side benefit. But based on the numbers that I just gave before, they are still in less numbers for those who are being hospitalized, as well as those who are being admitted to the ICU and having use of ventilators. So I don't think it's a higher percentage of people that are vaccinated that are getting COVID. It's still namely unvaccinated. And to answer your question, fully vaccinated is currently at this point, either you've completed your full vaccination series within 4 to 6 months, or you have been boosted if it is greater than that.
Our next question comes from a viewer on Facebook asking, if one did not get their booster shot and got COVID, do they need to wait a certain amount of days before they get their booster shot? Dr. Wu?
Yeah, I can answer that. So there are no firm guidelines. Here, what we are recommending is that the best booster or the best shot is the one that's in front of you, and we don't want you to delay in getting your shot. The conventional recommendation has been 90 days, but we have always said that as long as you are out at least 10 days from your initial illness and you have recovered and your symptoms have, for the most part, largely resolved, that you can get your vaccination.
Follow-up question from Tracy. Can you quantify the increase you are seeing in your ERs? Dr. Robinson?
Over the last couple of weeks, we've seen a 25 to 30% increase in our daily patient volume. Generally, we average about 300 patients a day, and over the last week to 10 days, are averaging around 400 patients a day. So a really significant increase in the number of patients coming to the Hartford Hospital Emergency Department each day.
Next question from Mary Catherine, Hearst Connecticut Media. Dr. Kumar mentioned other diseases are creating burden. Does that include the flu this season?
If I can have Ulysses answer both next question as Dave's question as well regarding the flu, that would be helpful.
Yeah, absolutely. I mean, there are other diseases. And so we know that COVID has postponed people's coming to either their primary physician or to the hospital. And so we have certainly seen an increase in those cases that are non-COVID related. In terms of influenza hospitalizations across the state remain fairly low, but it is not meant to be peak influenza season at this point. Now, it is higher than last year, but then again, having any cases would be higher than last year. And that a lot of that has to do with masking and, or I should say lack thereof. We do expect influenza to continue to increase, but right now the numbers across the state are fairly low. And I think maybe I answered Dave's question as well.
Yes, there's, do you have numbers to illustrate the emergency room increases? Dr. Robinson, do we have numbers at this point, or is that's pretty fluid?
I don't have exact numbers for flu cases seen in the emergency department. I do know, as Dr. Wu reported, that our volume of flu-related cases is very low at this time.
Eliza Fawcett from the Hartford Courant, as the current COVID-19 surge accelerates, what could we be facing in the coming weeks?
I'll take this next two questions regarding the visitation as well from Eliza. So Eliza, this Omicron surge has been somewhat unpredictable and to plan this out so far. I think we've seen rather high estimate of positivity across the nation and many of the areas, and impact on the hospitalization. We think we are going to continue to have some more increase in our hospitalization and community spread over the next several days. And after several days, not weeks, we will see hopefully a decline in both of those numbers as well. So we expect for some more stress related to the holiday season, traveling, and a variety of other things as well in the next several days. Regarding the visitation, let me clarify, Hartford Healthcare is not restricting visitation, we're streamlining visitation. I think it's really important to say. We have always believed that the patients are well cared by our colleagues when their advocates, the family members, and the relatives are involved in the care. And we take this decision about visitation very seriously across the Hartford Healthcare. So just to clarify, Hartford Healthcare does allow visitors to come and visit the patients. The request or change we are making right now, one visitor at a time, and not multiple visitors coming and seeing the patients, which creates an increased risk for the patients and the visitors and our staff for COVID exposure. So that's the change we are making across the system, including emergency rooms, including our inpatients and critical care for both COVID and non-COVID patients. What's important to note that we do have special accommodations for people with disability or compassionate care in maternal and childbearing areas. So it's still a welcoming policy, which I hate to say it's not restrictive, it is more inclusive, but cautious and safety-oriented policy at this time.
Question is, Omicron less serious to Delta because of the way it impacts the lungs? Dr. Wu?
I think there still needs to be some data that needs to sort this out. So as we do know, Omicron is more likely to be transmissible, but it's the prevailing animal studies, as far as I know, are that it's less likely to replicate within the lungs. And so that's maybe a reason why it is less serious, but I think it is still early.
Alex, at the current, according to state numbers, the percentage of vaccinated residents hospitalized with COVID has increased the last few days. Are you seeing more vaccinated patients? And if so, what does that say? Dr. Kumar?
Yeah, we have not seen a significant shift. And Ulysses, please correct me if I'm wrong, but at least last data I saw, we have not seen a significant shift in the vaccinated individuals who are requiring hospitalization. I think it's really important to note, if you're vaccinated and you're boosted, you have a milder disease. You may come to the ED, but actually do recover better. we are still seeing the significant or the critical care illness mainly, mostly actually, majority of the time it's unvaccinated individuals right now.
Our next question, can you comment on the CDC shortened isolation and your thoughts on the lack of a testing component right now?
Yeah, I'll take that, Camila. So just to clarify, CDC's isolation requirement for healthcare worker is welcome change right now. The conventional policy, in the sense that when we don't have a major staffing shortage or any other significant issues to manage the services, it does still require testing before the individuals can come back after 7 days minimum period of isolation if they're positive. Now, we've been fortunate in Hartford Healthcare that we've not seen a significant staffing shortage to go to that level. However, we're looking at the policy very carefully, and obviously we'll make some changes based on the data as it emerges. If individuals are in, the hospitals are in what they describe as a contingency or crisis mode, where there is a significant shortage of staffing, which may impact services to be provided, the critical services to be for the community. And at that time, individuals can come back without testing after wearing masks and other things if they're positive. We're not quite there in Hartford Healthcare, and we hope we will not be there as well. So it's a good change from CDC, so we welcome that, but hoping that we will not have to use that policy in Hartford Healthcare.
Follow-up question from Tracy. So on the one hand, you are saying you have more and more people in the ER. On the other, you say you don't delay. How do you parse that for the public, Dr. Robinson?
That's exactly right. If you have chest pain or significant shortness of breath or weakness such that you're having a stroke or anything that serious abdominal pain, that whole list of really acute symptoms, you need to come to the hospital right away. Like I said, we've been doing this for a while. We have awesome triage nurses. We will ask a couple of questions to determine your acuity or how sick you are. And the highest acuity patients are prioritized. If we think you're having a stroke, you get seen right away. If we think you're having a heart attack, you get seen right away. The highest acuity patients will not wait.
I'll just add one other comment, Tracy. You know, the role of the hospitals like ours, we take it very seriously to save lives, reduce suffering, and we do everything what is needed to do those things. Our teams across the Hartford Healthcare are committed to make sure that we provide that level of care. We have been very concerned as healthcare professionals that the individuals have put off their much needed care for some time, and they're showing up to the EDs and our facilities and other places in much worse shape, which could have been prevented and could have been changed with early intervention. So there are multiple different venues. Emergency room is not the only place. We have a primary care clinics, we have virtual care clinics, we have specialty clinics, we have GoHealth as urgent care, and we have our emergency room. So if you do have any illness or you're suffering with any ailments, please seek out help. Reach out to the doctors and seek care at the moment.
Our next question, how has at-home testing impacted the reporting of COVID numbers? When would you recommend a person take an at-home test and or following up with a PCR test?
Ulysses, you want to take that on?
Yeah.
Yeah, absolutely. So home testing, I think it depends what you're talking about in terms of the impact of the reporting of COVID numbers. At-home tests are not reported. And the analogy, or I guess the parallel I would say, is when early on when we didn't have a lot of testing, but we knew that a lot of people were positive. And so I would say it's probably very similar to that situation. But in terms of the reporting of at-home tests, it is not required at this point. So when would I recommend a person take an at-home test and or follow up with a PCR test? It really depends on the situation, and it depends what you're planning on doing. I wouldn't recommend at-home testing just for the sake of testing, because we do know that there's a lot of people out there that are continually testing just to see, but I would certainly recommend it if you are having symptoms. I think that would be the most important thing. And number two, if you are planning on going somewhere where you could potentially expose other people, whether you're symptomatic or asymptomatic. When should you follow it up with a PCR test? Well, it depends on the expectation that you may or may not have COVID. If you really think you have COVID and your test is negative, I would certainly recommend getting a PCR test. If your test is positive and you have symptoms, it should be consistent, but some people like to get a PCR test on top of that. But I would recommend getting a PCR really if your test is negative, but you have a high suspicion that you have COVID.
Tracy's looking for clarification, Dr. Wu. The number of those who are fully vaccinated in Connecticut hospitals has been rapidly rising to more than 450 patients as of Monday. The first time since the state started reporting the percentage of hospitalized patients who are not fully vaccinated. The amount has dropped below 70%. According to the state's data, 453 out of the 1,452 patients, 31.2% were fully vaccinated.
Yeah, so I guess I have to go back and clarify my other definition. So my clinical definition of being fully vaccinated right now is completing your full dose series as well as having been boosted as well. The CDC at this point does not recognize that as their definition. Their definition is just having completed the primary series. So there will be a little bit of a mismatch in terms of the definition here. Now, with regards to the numbers, when we first started tracking the numbers of who was vaccinated and who was not vaccinated and who was in the hospital, guess what our number was? Way back when, it was 32%. Right now, it is 32%. So that number has vacillated in between about 22 to 32%. So it has changed. And certainly we've gone up in the last few, I'm going to say days to weeks. But if you're basing it off of the conventional definition of the CDC, that does not include you are fully vaccinated even if you haven't been boosted. You've been considered fully vaccinated. So that may be one of the reasons why we are certainly having an increase in numbers, which I will put in air quotes, are fully vaccinated but not boosted. And that really needs to be further defined.
NBC, a question from NBC. How many Hartford healthcare staff are currently COVID positive or out due to COVID? I know that's a fluid situation. Ajay, do you want to take that?
Yeah, I don't have an exact number, and this is a challenging situation because the COVID positive and comes out, sometimes the reporting is delayed in that part here. So I wouldn't want to comment on that. I think the most important thing to stress is that we have adequate staffing in all areas to support the need for the community. And that's a better answer right now.
Question from Mike at Channel 3. Is there a way for people to report the results of their at-home tests? Is there a concern that if people are relying only on at-home tests, it could skew the statewide numbers used to make policy decisions?
I don't think there is a mechanism to report the at-home tests.
Okay, we have another question regarding visitation. Do you have to show proof of vaccination for visitation? Dr. Kumar?
No, we don't require proof of vaccination or proof of testing, but we do advise our visitors to make sure if they're symptomatic, if they have any illnesses, they do not come to the hospitals. And when they come, they are expected to wear masks and appropriate PPE. They're expected to follow the appropriate PPE guidelines when they visit.
And Mary Catherine has a follow-up question. As Hartford Healthcare looks to expand testing capacity, what are the biggest challenges in doing so? Staff, supplies?
It's a great question. The challenge is always has been the staffing. We don't have any issues with supplies at this time here, and the labs actually have a very good capacity to turn around the test as well. Staffing is always a challenge, especially in the times like that. But we are committed to make that happen. As we indicated, the Hartford Healthcare has been very proactive in recruiting individuals in the system. So we are expecting to open more capacity in the next couple of weeks.
Okay, don't see any other questions in the chat. We will start with closing remarks. Dr. Wu, do you want to begin?
Sure. Yeah, absolutely. I think right now what we are dealing with is we're looking at this interesting interaction between Omicron and Delta and how it's affecting not just our overall well-being and our health, but how it is impacting those who may or may not be coming to the hospital, as well as those who may or may not be fully vaccinated at this time. I think over the next few days to weeks, we're going to see a clarity that will discern exactly what direction we will be heading with regards to this current wave. And I do think that it will be favorable in the sense that based off of looking at other places that have dealt with the similar situation, they have rapidly recovered. So I do remain positive that that we are going to be headed in a favorable direction, but we are in an unprecedented time with regards to diseases where things are changing on a day-to-day basis. We've never really seen anything like this really in our history, maybe going back to the Spanish influenza back in the early 1900s, but it should be, there should be clarity coming forward from here on out. And I do think it will be favorable.
There was one other question that came in on Facebook that if you do take an at-home test and you do test positive, what do you do? Some folks are going to the ER. Is that, what do folks do if they take an at-home test and they test positive?
So I guess I'll answer that. It really depends on the reason you took the at-home test. If you took the at-home test because you feel really bad and very terrible, as Dr. Robinson said, we don't want you to delay. Yes, you should go to the ER. But if you have tested positive and if you feel fine, or if you tested positive and you don't feel anything at all, there's not any reason for you to go to the ER if you are asymptomatic or mildly symptomatic. If anything, you should talk to your primary care physician. They can arrange for follow-up testing, or you can stay at home, sequester, and quarantine. But come to the ER if you're feeling really sick. But otherwise, we certainly don't want everybody with a positive at-home test to come to the ER.
Thank you, Dr. Wu. And Dr. Robinson, any final thoughts?
Just to emphasize what has been said by Doctors Kumar and Wu, if you're really sick, you need to come to the hospital. We've been doing this for 22 months now. We've figured out how to adjust our operations to take care of the sickest of the sick patients, as we always have, while also seeing an increased volume of people with COVID that may not be as sick. It's safe. We really don't want you to delay, because if you delay, you may end up being even more sick. So if you're worried at all, if you're having any symptoms, you need to come to the hospital like you would have 2 years ago.
Thank you, Dr. Robinson. And Dr. Kumar, final thoughts as we wrap up.
Thank you, Tina. I do want to remind our community and media and other members, this is not the time to panic. We know exactly what to do and how to manage. The reassurance I like to provide that the institutions such as Hartford Healthcare and many others across the state of Connecticut are well positioned to serve the community's need. So I don't want panic or worry of that level at this time in our community. What we need to advise people, be thoughtful. If you're sick, if you're not feeling well, try to stay at home, remain isolated, wear the mask, to follow all the precautions you can at the moment to prevent illness in your family and in yourself and the surroundings as well. Hartford Healthcare has a tremendous culture and wonderful colleagues. Every single colleague is working hard at the moment to make sure we maintain the access and support for the community, and we'll continue to do so. We manage our operations on a daily, multiple times a day basis to make sure we are ready to support whatever is needed at the moment. And we are here to support in all times of this pandemic crisis. I do want to highlight one of the things is that in a positive side, Hartford Healthcare has given more than 2,800 monoclonal antibodies. These are the individuals we hopefully have prevented from getting worse or requiring hospitalization in this pandemic. We have been giving oral antiviral medication right now, hoping to prevent illnesses, severe illnesses as well. We do have large access points through GoHealth, virtual care and primary care, emergency room. So there are multiple venues and ways one can interact with a healthcare setting to seek assistance at this time here. So while we augment our access and support the need for the community, I do want to remind everybody that we are doing all we can to support the need at this time here. So not a time to panic, but to be cautious at this time.
Well said. Thank you, Dr. Kumar. Thank you, Dr. Robinson and Dr. Wu, for making yourselves available for our daily media briefing. And thank you to the media and to those on Facebook who are watching us for all of your questions. We hope that this helps you in your reporting and getting the messages out there. We will be back here tomorrow at the same time at 11 a.m. We hope to see you all, where we will assemble our clinical experts once again and make them available to you. But for now, we will see you tomorrow. Be safe. Thank you.
Thank you.